So thank you so much. Today I am interviewing Dr. Charity Sneed Watkins. She is a professor at North Carolina Central University in the social work department. She's got a host of and a wealth of information when it comes to maternal health. Dr. Watkins, do you want to share with us your background and how you have come to the work that you're doing, the courageous work that you're doing inside of maternal health?
Sure. First of all, I want to say thank you so much for the opportunity to interview with you. I am a big fan of your work as well, Fawn. I came to this through what could have been a very tragic experience. My own personal experience of being diagnosed with peripartum cardiomyopathy or pregnancy related heart failure 2 months after having my daughter, and it wasn't necessarily just that diagnosis that contributed to me wanting to research maternal health, but it was the experience of being diagnosed, how many times I had to go to a
Mm,
provider in order to get a diagnosis, how many times I was ignored, my symptoms weren't taken seriously, how many
mhm,
times I had to just wait and wait and wait with no answers, and how that prolonged the process of getting diagnosed, and how that could have contributed to even more harm
mhm,
in my case. And so because of my own personal experience with being diagnosed with this, I can't change my own personal experience, but I can hopefully use my experience and expertise as a researcher and social
mhm.
worker to inform the experiences of other Black women moving forward. So my work has really emerged from personal experience, and much of my research really speaks to how personal experience needs to be viewed and treated as expertise. And that's, patient experiences, but also the experience
Mhm.
specifically of Black women who are giving birth and facing the threat of death while giving birth.
And I have to agree with you. I think a lot of times, and through the years, what we've seen in the past when it comes to healthcare and medical providers, that they often do dismiss the personal and lived experiences of the clients that they're taking care of. And specifically, they often just dismiss the personal and lived experiences of Black women. And when we are saying the things that we're going through, some through just being uninformed, some through intentional not wanting to listen to what we're saying, some through stereotypical or bias of what they've had or how they've been taught through medical training. So it's a many different ways while they have arrived to where they are. So it's wonderful to see to be in a space right now where advocates are really pushing hard for lived experience and personal experience when you're having these conversations surrounding maternal health and just public health in general. It's relevant, it's needed, and that's the only way that we're going to have sustainable health outcomes is talking to those who are having those experiences, engaging them in the experience of what would help you or have helped your situation opposed to assuming. So I thank you for sharing that. One of the questions that I have for you is what do you believe or what do you believe are the most significant structural determinants contributing to the high rates of Black maternal mortality in North Carolina?
So what we're experiencing right now, and what I'm hearing about a lot is housing insecurity, especially in my area. We have a booming number or growing population, I would say, a booming population, especially here in the Triangle, where there are a lot of folks from out of the state who are coming here to move, whether
Do you
it's
mind defining the triangle for those who don't know what
sure.
define? Mhm,
So the Research Triangle includes Raleigh, Chapel Hill, and Durham. And it's an area where there is a lot of medical, technological,
mhm,
biomedical, pharmaceutical companies and industries that are housed here. And so we have places, for instance, like RTI, Research Triangle International, I believe it's called.
mhm, mhm,
We have a lot of other institutions and organizations, SAS, Cisco,
mhm,
Apple, all of these places are here, which means that their employees are coming here. and their employees are coming here from places that have a higher standard of living, which means that housing is now rising in costs because it's like, well, if people here, if people are coming here with more money, then we can raise our prices. However,
Mhm.
for those who are residents here in North Carolina, born and raised, they're being priced out of their homes. They're being
Mhm.
priced out of rent. And I'm seeing this at numerous levels. I'm hearing it among Black women who are giving birth and also facing housing insecurity or homelessness while they are pregnant or right after giving birth, which is a very vulnerable time
Mhm.
overall, but can you imagine doing that without having a place to live? I'm hearing it among my students who are coming here for school, and really living on campus is the only housing option that they have. I'm hearing it everywhere. I'm hearing it among professionals about how the cost of living is really making it difficult for them to save, for them to invest in other ways of you know, not just working to pay bills, I would say. And so I would say just the growing cost of living in North Carolina has been a very significant contributor to some of the inequities that we're seeing in terms of birth outcomes. Because as we know, when you are mentally stressed, it affects how your body is handling stress.
That's right.
And so that allostatic load, especially when you're sitting at the intersection of being both a woman and a person of color, specifically a Black woman, it can be very challenging when you are having to both navigate the biases and the discriminatory practices that are faced by not only women, but also by Black people. But now you add the vulnerability of pregnancy or postpartum period, and it's surmounting. It's a lot.
It is.
While also trying to make sure that you have a safe place for your baby to come home to, and that you have a safe place to recuperate from giving birth.
I love that you touched all socioeconomics when you explained um, housing insecurity, because that is something that I personally was just shared with someone just shared some information with me. So we in Wilmington just got a new DEI. Chief DEI officer for the city of Wilmington, and she shared with us that when she first moved here, they gave her an allocation of how much she could use in order for her to get a new place to stay. Well, when she was trying to find an apartment, before they knew who she was, she got declined. She got denied. And she was like, "But I make 10 times the amount that you're telling me," and so she was denied. So then they actually had to go and she had get the actual HR officer to go find her a place for her in order for her to get the rent that she was looking for, and they actually because they were also they were elevating the amount that they said that she that they were trying to tell her how much. So if the rental rate was, let's say, $500, I mean, I'm not saying that it was, but it's a whole lot higher. They were telling her it was triple the amount, $1,500. And she was like, but over here it says something different.
Right,
So
right.
yeah, housing insecurity is a real issue, no matter if you're in a lower socioeconomic space or if you are an executive. You're experiencing it across the board. In addition to racial bias, that we're also experiencing that, and that connects to my next question. How would you say that racism and sexism interact in impacting these outcomes?
Ooh, racism and sexism really conflate inequities when you combine them. So some people think of intersectionality as almost like you're facing one inequity at a time, but it's really, and I think back to some of the old movies we used to watch where there would be fighting scenes, and it'll almost be like one person waits for the other person to fight and get knocked out before they come in. That's not how inequities work. That's not how intersectionality works. You are literally being jumped by racism and sexism at the same time. And then we can add classism, we can add ageism, we can add ability status, all of these other things that, kind of, add to it: gender identity, sexual identity. What happens for Black women who are sitting at this intersection is that you are constantly navigating two inequities in which you are oppressed,
Mm-hmm.
right? So it's not just you have privilege on one end and then you may have some inequities on the other and it kind of balances out. It is 2 points of oppression,
Mm-hmm.
2 points in which you are experiencing discrimination. And discrimination when it comes to misogynoir or against Black women, sexism against Black women, there is another layer that comes onto it. Because if you think about who do you have to worry about as a Black woman in terms of experiencing oppression? You have to worry about white men, white women, but you also have to think about how that may come across within Black men and your relationships with Black men, because now we're talking about sexism within Black community. We're also talking about racism across women. And so like, it's just so many different layers that really add onto each other and compound to make it where you don't know where the punch is coming from. You just know that it hurts.
That's right. I love that example of using old movies like people taking turns for a fight scene. But you're absolutely correct. When we are encountering these issues, they're hitting us all at the same time. You don't know, which reason why someone, sometimes you want to sit back and try to be as unbiased as possible and say, let me just use my logic. Was it really that? Am
Yeah,
I sure that this is really what this situation is? And unfortunately, oftentimes it really is what we thought it was. We want to give people the benefit of doubt. We want to make sure that they are doing things in fairness and with a good heart, so to speak. But our unfortunately, that is not the case.
right.
And it really is rooted in sexism. It really is rooted in racism, and we have to be more vocal to call things out. Because that's exactly what it is. You're not crazy.
Right.
What you're thinking really is what the issue is. So I love that
Yeah.
example.
I actually, when I've talked to hospital executives and folks who um, really guide and shape what healthcare looks like in our country, I always tell them that part of the burden of being a Black woman is that you never have the answer of who threw the punch, right? So oftentimes you are wondering and having to process on your own individually, internally mostly, whether something was because of your sex, whether something was because of your race, whether something was because of your race and gender combined. You never get those answers though. So while you are thinking about it and stressing about it and your body's reacting to those feelings, the other person who actually did that harm goes on about their day. So that's just
That's
an
right.
additional layer of burden that comes along with the actual harm that you experienced, whether it was, a microaggression or a macroaggression. We have to sit with that question as well.
We do, and what happens is that this contributes to the theory of weathering, of
Mhm.
why we are so worn down, so tired. But on the other side of that weathering, it also contributes to why you see so many educated Black women, and that is because we feel like if I only get this one more degree, or if I only get this one more certification, if I only get into this particular income bracket, then hopefully this will eliminate these
Right,
issues that I'm experiencing, right? So
right,
if I'm more educated, if I'm in a better income, if I live in a certain specific area, if I drive a particular vehicle, if I marry this particular person, hopefully, ideally that this will protect me and it will be my
right,
cocoon to keep me from experiencing these particular issues. Because as I'm coming up, I see what looks like when you don't have these things, right? So I see how life is if I don't have degrees, if I live in a particular home, if I drive a particular car or live in particular neighborhoods, I know what that looks like because that's what my roots are from. So
right.
in order to get out of that, I'm striving to have and attain something greater. But the sad part is in your striving to attain something greater, you end up experiencing the same health outcomes and the same health issues as those that you're trying to elevate, or the circumstances that you're trying to elevate out of.
And unfortunately, actually, sometimes it's even worse
Yeah.
because, like, what we see with Black women, Black birthing people, I would say, is that the rates of maternal mortality actually increase, or the chances, in reflection of, how often it can be. It actually gets worse for Black women who have graduate degrees, and who have higher incomes. So typically, Black women have a risk of 3 to 4 times more likely to experience maternal deaths, during, before, or after childbirth. However, Black women with graduate degrees and, with higher incomes, that rate can be 5 times higher compared to their white counterparts. And so that weathering, meaning, just thinking about how often you're being rubbed against when there's fewer and fewer people who look like you, who you can seek
Mm-hmm.
support from, who you can bond with and find different ways to cope with, the experiences of micro and macroaggressions. When you have fewer of those opportunities to receive support, that means you have an even higher likelihood of having those effects of stress, race-related stress specifically. And so Black women with those graduate degrees, our education doesn't protect us. It actually places us at higher risk, and even higher risk than white women without a high school diploma. So
You
our
said,
maternal health rates are actually worse than white women without a high school diploma, which points to the
mhm.
only thing that could be cited as a reason for that discrepancy or that inequity, which is racism. It's not education. It's not how you're living or whether you have access to healthcare, quality healthcare. Is none of those social determinants of health as we usually discuss it. It is
Mhm.
specifically racism.
You said something that really caused me to tune in a little bit more, when you said no longer really having the support systems. It made me think about how you are correct. When we were let's in a less educated, formally educated, I'm gonna say it like that, in a less formally educated space. So we were around our community in our neighborhood. We had that support system because you had that language and that commonality of, that girlfriend kind of talk, that community led kind of conversation. But once, as you are striving for attainment, you no longer are carrying them with you. So
Right.
because you're moving outside of the box, you're not. Some will say, oh, you're trying to think you're better than, or you're trying to, be different. But and so you no longer have that support system that you traditionally would have had, that is normally there to support you when all of us are traveling on the same bus, if that makes sense. If
Oh
all of
yeah.
us are from, McDougal Terrace, if we're all from McDougal Terrace, then we all know what we're going through. We all share that same common language. But the moment that I move from McDougal Terrace and I move to North Durham, there's nothing there that's out there to supporting me outside of me getting my education and my better home and all these things that I'm thinking I bear. There's no barrier there. And so that
Right.
makes total sense in what you're saying, why you're much more weathered, because who are you going to talk to?
Right. Right.
Who's going to
And
understand?
right. And you are also more exposed to those
Right.
microaggressions. It's become a part of your daily life. So instead of having maybe a few interactions, maybe in the grocery store, or
Mm-hmm.
when you are shopping, someone's looking at you or following you or looking, giving you a weird eye. Those are maybe
Mm-hmm.
rarer occasions, but then once being surrounded by whiteness is a part of your everyday life, is where you live, is where you work, potentially even where you worship,
Mm-hmm. Mm-hmm.
romantic relationships. We also have to think about who are you partnering with
Right.
potentially, you know, um, you know, change in terms of your socioeconomic status. Those are all opportunities for more harm to
Mm-hmm.
occur. And it's unfortunate that we have to look at it that way. But, you know, kind of climbing the ladder can be a very socially isolating experience for some.
Yes, yes, that is, oh gosh, that's something to think about. That's a whole study in
Oh
itself.
yeah. Oh yeah, definitely. Definitely.
Yeah, it really is. So as part of your work with the BIRCWH, and I'm going to get you
Mhm.
the birth scholar, you focus on severe maternal morbidity. What upstream interventions, such as policy changes or societal shifts, do you see as critical in addressing systemic inequities affecting Black birthing persons?
Yeah, well, first we need to have a common definition of what severe maternal morbidity is, because maternal mortality is pretty, you know, definite. We know what that is. There is only one outcome that we are dealing with when we talk about maternal mortality. But maternal morbidity, which is
Right.
the time when you experience a severe life-threatening event, medical event. Um, that typically happens during pregnancy or during childbirth and labor delivery or during the year following childbirth, there can be some very serious consequences and implications for an individual, which is why I decided to concentrate on severe maternal morbidity versus mortality, because we have people who survive this. But what
Mm-hmm.
does life look like afterwards? So a definition we have kind of gone back and forth, and some people use one definition, some others use a different one. We are still trying to nail down whether the postpartum period ends at 1 year. And if it does
Yeah.
end at 1 year, why is the last appointment that you have with your OB at 6 weeks? Why
Mm.
are we only counting deaths that happen within that 6 week postpartum period as being pregnancy related when we have evidence to show that these things can carry forward a year or more?
Or
Um,
more. Yeah.
or
Mm-hmm.
more. And so, first of all, the first thing we need to do is make sure we are capturing correct data on how many people are experiencing severe maternal morbidity. And I think that is where we are still at. We haven't even gotten to the point of addressing what happens as a result of
Mm-hmm.
severe maternal morbidity. That's what I focus on, is like, you have survived this, you have survived, you know, facing death while giving birth. How does your life change after this? How does your perspective on being a parent or being a mother or birthing person changes? How does that affect your relationship and your connection with your child when literally they may be viewed by you as, you know, one part of a very traumatic event that happened in your life? How does that affect how you approach childbirth, or how do you approach parenting? If this means that you can no longer have any children, how's that affect your, you
Mm-hmm.
know, your relationship with that child? How does it affect your relationship with your partner after facing this life-threatening event? And so, you know, there has not been a lot of policies that have specifically focused on that postpartum period, since we still haven't nailed down what that period is. But there are, you know, pieces related to, you know, preventing severe maternal morbidity, such as the Momnibus bill that is at a federal level, and also here in North Carolina. We
Mm-hmm.
are the second state to really push this forward after California. There are policies and that are being introduced or proposed that would address, you know, implicit bias among providers, that will offer more wraparound services for individuals who have given birth, would make access to doula care, to midwifery care, these things that have been shown to be protective, especially for Black individuals. All of those things are being captured there. Also, maternal mental health.
Yeah.
What we don't always talk about it, but you know, cardiovascular disease is one of the top reasons for maternal death for all Black women. However, for all women, it's actually mental health disorders that are the number one reason for maternal death. So that includes overdoses, that includes suicides, that includes, you know, anything that means that you are mentally checked out or you're not mentally able to take care of yourself as well as your baby. So we also
Mhm,
are looking at how maternal health is related to infant health. And so
mhm.
there's just so many different pieces that we can look at, but I think we are still in the early stages, despite the fact that we've been given birth forever. We're still in the early stages of really being able to define what needs to occur to prevent these negative consequences. And we, at this point, from my understanding, my research, we are still trying to nail down what those consequences are, especially when the consequence is not the worst outcome, which is maternal deaths.
I think it's interesting. I love the fact that there's a conversation around expanding, and defining what we determine to be postpartum.
Mhm.
Because it can go from anywhere from 6 weeks up to 2 years,
Right.
that you have actually seen. And we've seen this outcome, especially when we are seeing mothers who are in serious mental trauma.
Yeah.
All over the world, or we have seen, especially here in the United States, where women have gone and taken themselves and their children, and committed, traumatic events, all because of the mental health stress that comes behind becoming a mother. Um,
Mhm.
and even if you don't have anything specifically traumatic in the actual delivery itself is trauma.
Yes.
know,
Yes. Yes.
Many people forget that having a child is the closest that you will get to death ever in your life. Now, do that multiple times.
Right.
And on a regular basis, and how far it takes you in terms of the level of stress that it causes your whole body to
Yes.
experience, from the time of carrying your child to the actual time of birthing, going through delivery, and having that child. It is extremely stressful, even
Oh,
if you
yeah.
don't have morning sickness, even if you have a perfect 9 month pregnancy, 10 month pregnancy, because I don't know why they say nine
I know.
months.
I was pregnant for 10 months.
Listen, 40 weeks is
I was
for real,
40.
all of 40 weeks, okay? And
Yes.
I got the
And she had to
certificate.
be evicted still.
Listen, I got the birth certificate to prove it. So all of 40 weeks I was pregnant. And I still never understood why we said 9 months. I know technically they say that you can give birth at 36 weeks, but for the most part, most doctors
Yeah.
usually let you go to 40 weeks. But even if you have a smooth
Yeah.
pregnancy term, that time when you go in to deliver, it's just it's foreign. And to add into that, it's taking you out of how you traditionally should be giving birth. We're giving birth on our backs, when
Yeah.
traditional birthing is sitting or standing.
And
It's
yes.
how, right? And so now you are putting more stress on your back and your lower muscles to
Yep.
push something that naturally would have dropped out.
Exactly. And it's so fun because we have become a more sedentary society anyway. So
Right.
it's just so interesting that giving birth has also kind of fallen into that trajectory as well. But I also want to point out one interesting thing that I just thought about is that pregnancy is the only time anyone is ever told that you need to think beyond yourself,
Right.
that you need to sacrifice yourself for someone else.
Right.
It is a part of how we view pregnancy. Is like it's all about the baby. You kind of think about it when someone sees that you have they're looking at the baby and they're asking, "Oh my gosh,"
They're
but
not
then the
checking on you.
mother, right? Exactly, and it's more in
And
terms.
God forbid that you're selfish to say that you don't want to go through that process.
Exactly, exactly. And so it's like we are literally receiving the message that our value isn't as important
That's right.
as a baby who isn't here yet, right?
Hmm.
Who we need to make sure we're taking care of ourselves in order to get here safely.
Hmm.
And even then, when we are taking care of ourselves, we still have all of these systemic issues that threatens the lives of our babies that we have literally physically poured into
Hmm.
for 10 months,
Hmm.
you know? And so I think even that messaging of, pregnancy is the most joyful time of your life, but it's also the time when you're told not to care as much for yourself, to put yourself on the back burner, to do what you need to do, sacrifice for the well-being of your infant or your the fetus at this point. You know, that no one else is told that. There's
That's
not
right.
a time when men are told you need to sacrifice everything that, in terms of what you value, what you care for, what makes you happy for someone else. But that is a message that women get. And then Black women,
Mhm.
there's a whole nother layer to that, right? So not only you're told on a regular basis that you have to work twice as hard to get half as far, that you also have to be a superwoman and be able to do it all, that you're going to have to provide emotional support to others, and you need to be the strong, arc of a family. On
Mhm.
top of that, you also need to sacrifice yourself enough to bring this child into this world.
You're
And
making such
so
good points. I wish I had a little clap or a candle because I'd be going.
it's like in that, and I mean, we can have a separate conversation about how this relates to our, the recent election results, but how many times are Black women going to be told that you don't matter? And that in itself also contributes to that weathering, you
Yeah,
know?
absolutely.
You're always being washed over, right? Just think about, rocks at the beach. What happens? You start to erode. You become smaller and smaller,
Mhm.
but yet you're still being expected to carry all of this weight, to
Mhm.
manage all of this, and
Mhm.
still stand stone still, right?
Mhm. It's
You
still
got
expected to hold the water back, even though the water
exactly.
keeps
It's
eroding.
it rolling over you, and it's
Rolling over.
wearing you down. People can
Right.
see that it's wearing you down,
Mhm.
but you still have to hold down the fort. And so that is the life of a Black woman. And
That's
that
an excellent example because the example of the pebble of the stone, so to speak, on the beach, because you're expected to hold the ocean force back, and you're supposed to protect the boundary. you
right.
know and that's the life of a Black woman, is that we're
Yes.
constantly in duality, or even more, different spaces. We're doing this and having to do this all at the same time, while still being the what we were created to be, which was the rock. Right.
Right.
But you can't even
Right.
truly be the rock, because you're still managing all these different things. So yeah,
Right.
that's such an
Yep.
excellent example. Yeah.
Yep. Yep. Exactly.
So when, as you are looking through this information, and we're talking about this, takes us right into an excellent space of chronic stress and epigenetic changes that have been linked to adverse maternal health outcomes among Black women. In your research, how do you see some of these factors manifesting, and what are some strategies could you recommend to mitigate these effects that are happening?
Yeah.
Okay, there we go. There we go.
So in terms of the factors that contribute to the chronic stress, I always want to start off by first saying this is not an individual issue. It's not, and that means it's not just you choose to stress, right? No one chooses to stress, but our environmental factors contributes to our stress and how we're able to manage it, right? So in terms of like how it manifests and what we can do to mitigate its effects, we first have to become aware of when we're experiencing stress. We
Mm,
have become sometimes so used to stress that we normalize it as regular functioning. And when it becomes regular functioning, then we are no longer responding to it. Like that is what we have seen in terms of the physiological responses to stress. Is
right.
that Black individuals no longer have that spike in their hormones to
Mhm,
indicate that, hey, you are in a stressful event. You need to get out,
mhm,
right?
mhm.
You need to get out of this situation. That is, our body literally tells us, hey, you are in a stressful environment. You need to go. And then we can come back down from it. But what we have seen within Black individuals is that we are constantly at this high level of hormonal indicators of stress. which means if you're staying at this level all the time, coming down is not, there's no sense of normalcy. Like, this is the normal. This is
Mhm.
the norm right here. And
Mhm.
sometimes it gets even worse, right?
Mhm.
But now your threshold rose, right? So now we are deemed as having a higher capacity for stress because our bodies physiologically do not respond in the way that other groups may experience stress. But
Mhm.
that's just indicating to me that we're aging faster. So we talk about biological aging, that weathering contributes to us aging faster. We may look good on the outside, but inside,
Mhm.
our bodies are aging quicker. We're experiencing chronic conditions at an earlier age and having
Mhm.
high likelihoods of experiencing death because of those chronic conditions. Those are the factors that we are trying to mitigate. However, when we are talking about systemic issues, social environmental factors, it is going to require more than just individuals to choose to walk around a neighborhood instead of driving their car. It's going to require more than just saying you need to eat more vegetables per day in order to mitigate those effects. What we're talking about is systemic change.
Yes,
We need to talk about the fact that what contributes to someone experiencing those levels of stress? Is it
that's
being the
right.
only one in your company and you are constantly being told over and over again that priorities of Black individuals do not matter because they are not the target audience, for instance?
Mhm. Mhm.
Is it that you are, you know, you're hearing the questioning of DEI and the focus and the need for it within your workspace, and you as a Black individual see the benefit of it when it's done right, and you're having to fight for it, or you're having to choose not to fight in
Right.
order to protect your well-being.
That's
So
right.
these things require systemic solutions because they are rising from systemic issues,
Issues. Mhm.
right? So we can't tell an individual fix your environment.
That's
We
right.
have to say if your environment is a part of the problem, then it needs to be the solution.
Right.
So we
Mhm.
need larger structural changes to our health systems, to our social systems, to our education systems, our governmental systems, all the systems that have all the isms baked into them. All of them need to be reevaluated, sometimes uprooted, in order for us to get to a point where we can truly support the well-being of all people. But that
Yeah.
would be a goal first before we can actually change systems.
I love that how you said that because it makes me think about a concept I recently learned about called One Health, um, where One Health is integrated in every part of our society, from all the way from agriculture to how you are sourcing your food, taking care of the animals, all the way to the very end of how it's commercially produced, right? To what happens when it comes to your home, to how you ingest and you take care of it. When we talk, health has to be a part of every conversation
Mhm.
there is in that space. It cannot be isolated and segmented out to just public health or just only in healthcare conversations. When I talk about health equity, my conversation around health equity for me is not solely in the space of healthcare. Health equity is in every space that we are in. It's in every industry that we are in. It's from when you are working at Coca-Cola and if you're working long hours at the plant, how does that show up? If I'm working long hours, then I'm sleep deprived. Then I'm coming to work and I'm end up having a workplace injury on the job. Then I got to file a report. You see the domino effect of how all of that impacts. So health equity is in every industry. It's not solely isolated, but to healthcare. But oftentimes when we have our conversations, because it does begin with the conversation of health, we only focus on it in the space of medical providers and healthcare. When if we would take a look at the big picture, the big frame, and see how it plays a part in every avenue, I think that we would be much more successful in implementing changes and for our total or our global society's health outcomes.
Yep, which is why I focus on the role of social workers in maternal health because I'm going to challenge how things are usually done, especially what is usually done is not giving us the outcomes that we need.
Right.
Um, the definition, as we all know, of insanity is doing the same thing but expecting different results. We can
Absolutely.
no longer expect, we should no longer be in a space of expecting that we are going to have the highest rates of maternal deaths compared to any industrialized country.
Hmm.
We should not ever have gotten used to that, and it's time for us to change that, but we have to do things differently. And so I think about social workers are everywhere.
Hmm.
We're literally in so many different spaces. We're in schools, we're in government, we're doing policy. We are working with communities, groups, individuals, families. We do it all. You can find us in almost any space.
Hmm.
And so why are we not at the table when it comes to maternal health, especially when we're thinking about chronic condition of cardiovascular disease and how it's directly related to chronic stress? Why are we not, as social workers who are trained in mental health care, but also in interpersonal relationships and also in identifying systemic issues and addressing those, why aren't we here to address chronic stress, some of the key factors that contribute to the inequities that we're seeing in health, but also needs to be addressed in terms of solutions and the effects that come along after maternal death. So that's why I'm pushing. I'm like, we social workers is just one additional piece of the puzzle, right?
Right.
So we need to start thinking creatively of who needs to be brought to the table in order to address this long-standing issue that we can no longer just rely on what we have been doing to give us different results. We have to do something different.
And I would also argue that social work should not be brought to the table as a reactionary,
No.
as a reaction to what's going on, right? A
Right.
reactionary effect, because oftentimes when that social worker is brought to the table, it's because of a traumatic or an issue that they
Yeah.
want resolution into in terms of child care, child welfare, or the parent, or getting them on the right track, so to speak. Child, it should be, we also have to reframe what we are speaking of when we're talking about social workers in terms of a preventative stage, and how they are there to walk with people along the way and not there to be a part of the quote unquote system, and being in that supportive thing, like they're the people police, I guess you could say, you
Yeah.
know.
Yeah.
And that's
Oh
what a
yeah.
lot of times
Parenting
people
police.
think.
Yeah,
Uh-huh.
that's what I say. We're often positioned or called in to be the parenting police. So we determine how you parent, whether you're parenting well, and then we judge you on it, and we are viewed as taking your children or not, depending on that judgment, right?
Right.
Um, and so that is something that we have to take ownership for as a professional field, to think about how are we being perceived and how have we contributed to that
Mhm.
perception within,
Mm.
right? So I'm always I have this diagram that I've developed, the 5 A's, and please don't ask me to spell which one because I can't remember right now. But one of the A's, one of the early A's, actually I think it's the first one, is accountability.
Mhm. Mhm.
We have to, well, actually it's acknowledgement and then accountability, because
Mhm.
first, before holding yourself accountable, you have to make sure you have acknowledged what the problem actually is and how you, like
Mhm.
how we as a profession have contributed to it. So I asked for my profession of social work to acknowledge our role within eugenics movement, how we
Mm.
have played a part in harmful practices and research in recruitment of individuals from marginalized communities, how we aided in that and aided in their not only marginalization, violence that actually have occurred, such as the Tuskegee syphilis study. There were
Mhm.
social
Or the
workers.
North Carolina eugenics.
Exactly,
Mhm.
exactly. So,
Mhm.
I say as a profession, we have to point to ourselves first before we point at other people. We have to do some internal work to say, hey, we have not always been on the right side of things.
Mhm. Mhm.
Even some of our founding mothers of our profession have been on the wrong side of things. And we can't just uphold them without also acknowledging, hey, we were wrong about this. I'm a
Mhm.
big fan of saying I'm wrong about something
Me
and
too.
then asking for help for correction. and we
Mhm.
need to ask help for correction after we do our own work. We need to partner with those who are already doing the work, which are community-based, community-driven organizations, such as the one that I have the privilege of serving on the board for, Equity Before Birth, that
Yes.
teaches
What an
us.
amazing organization, amazing
Amazing.
organization.
And
Yes.
and and I'm amazed every day by the work of Joyce Spencer, and, the entire team, Leah, Star, uh, T Luna, like, it's a small but mighty team, and they get
Mhm.
stuff done. And I always tell Joy how much of a amazing model EBB provides to organizations who have the money, have the resources, but do not have the relationships
Mhm.
in order to really first hear from community members about what the issues are, but also to learn from them. So going back again to that lived experience, UNC cannot do that. Duke
Mhm.
cannot do that.
Mhm.
EBB that is community rooted can do.
Right. That's right. Do you want to speak real quick to equity before birth? One of the things I love about equity before birth is specifically into the framework. She's so intentional about protecting equity before
Yes.
birth. You know, one of the things that I was talking with someone yesterday, and we talked about how all money ain't good money, and she's real selective about who she partners with and what organizations she aligns with, who she allows her name and her branding to be connected to, because she's so serious about the work. So do you want to speak to equity before birth?
Yeah. So Equity Before Birth is a community rooted organization. And I will always point out community rooted is not the same thing as community based.
Space. That's
Community
right.
based is geographically, related. It's more of where you're housed.
Mm-hmm.
That could be any organization can have a place
Mm-hmm.
in a community, but community rooted means it's literally from the
From the
community for
community.
the community,
Mm-hmm.
right? So we have individuals who are a part of the community who are now serving the community, and they work directly with identifying with community members what the priorities are, what are the needs, what do you need from us, how can we ensure that we are providing those sources of support to you. And so EBB really fills up the gaps that are left from our social safety nets. They
Mm-hmm.
address the issues around midwifery care and how we don't have adequate access to that amazing resource. And that also includes access to doulas who are, there's evidence, it's evidence-based that having a doula there, someone who is not a medical provider, but is able to address and provide support that addresses those fears, addresses that need for someone else to be in the room to hear what I'm hearing. Like those kinds of things are supported through EBB, but you're not going to find at those larger institutions.
That's right.
And EBB does this amazing work of really, again, as you were saying, protecting by even the organizations that they partner with, because that's what EBB does. We don't provide the services ourselves, but we do the hard work of determining who is
Mm-hmm.
culturally affirming,
Mm-hmm.
who will have our family's best interests at heart, who's going to be reliable and consistent, who's going to be transparent, who's going to align with our values, those values that we have worked with the community to identify. How can we make sure that our families have the support that they need and they're not also being harmed while getting those supports? That's the beautiful part about EBB is that we have identified full spectrum doulas. We have identified um, culturally affirming, culturally congruent providers for mental health services for Black individuals who have given birth.
Mm-hmm.
That is something that is very unique, along with the fact that we now have our liberated birth um, recovery fund that actually creates a cohort-based support for families who do not have access to parental leave. And so while many folks with full-time jobs, salaried jobs, you may have 6 to 8 weeks of maternal health care and it's paid, and you take that time off and you come back. Many folks do not have that. If you're not at work, you don't get paid. And so we have developed this fund that will allow for individuals to receive direct cash assistance when a part of this cohort, and we trust them to use it as they need it. We're not going to be going in and saying, hey, only 10% can go towards groceries and 50% can go towards rent. No, we trust that you are an expert in your own experience and you can determine how that money needs
That's
to
right.
be spent. We also are giving you financial literacy classes because many of us were not told how to manage a budget, right? Me either. And I'm still learning.
Me too. Yes. I'm in a budget program now.
Hey, I am not, but I need to be. But like we are also providing those
Yes.
resources. We're providing Mama's Nights Out because we know that we want to recognize women as not just mothers, as not just wives, or not just in what other role you play for someone else in someone else's life. We want to recognize you as a whole human being, as a woman or a birthing person, and the resources and support that you need to be whole. And so, like, EBB is just rock stars, amazing work.
Yes.
And I can't take any credit from it. I just always find it a privilege to be able to speak about it.
I love when heard, so as you know, I'm a part of the SOAR collective.
Yeah.
And so when we were evaluating your organization, we have to evaluate several different organizations when we determine who we're going to give money to. And I'm proud. Look, I'm proud of the SOAR collective. Look, listen, we our own Black women, we're our own bank coming together, putting money together, and we will find an organization, a nonprofit Black owned organization and run organization, and we will seed into that organization, just so we can make sure that they're continuing to be able to do sustainable work. So as a SOAR collective, for us to be able to come and to support equity before birth, I think that we were just elated to be able to do it. And one of the things I also love about equity before birth is because you understand the assignment. You don't defer from what you're here to do. You know what you're here to do. You know your population, and there's no going outside of that. And I think that that is the challenge sometimes, when people say, well, I'm here to provide support for this population. Your population is too broad,
Yeah.
and it can end up causing more challenges. You specifically say we're here for Black women, point
Yeah.
blank, period, full stop, or Black birthing persons. And that is your population, and you will operate within that space. And I think that that is one of the successes of it, is that you understand who you're here for, you know what your agenda is, and you stick to it and nothing else.
Yeah. I mean, but we also, and I will say that we also recognize that there are other closely related populations that also need our support, such as
Mhm.
Spanish speaking
Yes.
individuals, individuals who have immigrated here,
Mhm.
and also need support. And so, we might broaden just a little bit, but we
Mhm.
recognize, as you said, we know the assignment. We know that we, like, at the core of our work is to face issues that are negatively impacting the who are deemed the most marginalized, right?
Mhm.
Those who have the least access, those who have the least supports. We are trying to fill in big gaps. Like,
Mhm.
we're not going for the easiest level
Mhm.
of impact. We're
The low
digging
hanging
deep,
fruit.
right? We're digging deep. We're saying, in addition to facing gender and racial bias, we're also considering language bias. We're
Mhm.
also considering, xenophobia, and how we can address those kinds of issues and provide supports for individuals, because at the core is about bringing healthy babies and protecting moms and birthing people through this process. That is what our goal is. We want to make sure we are a part of the solution for these populations who have been deemed more as the problem, that they're not the problem. We're
They're
working
not.
to change that.
And you actually have taken us right into that next question. And so, understanding organizations such as community, equity before birth, how relevant do you think it is, for us to have more trusted relationships with community rooted organizations?
Oh, it is key. Because and I would say this because I work in multiple places. I have multiple hats I'm working from. I'm
Mhm,
working within higher ed. I'm working with, you know, one of the top institutions for research at Duke University. I'm working at a HBCU at the same time. I'm also, in higher ed and teaching our next generation of social workers. And I'm seeing how people relate differently to community, even how they define community differently. And what I see is that EBB has the connection to community, has the trust.
mhm,
Like that is something you can't pay for. You can't pay for
mhm,
trust,
mhm.
right? You can't just throw a few dollars at trust and think that you're going to get it.
That's
That
right.
comes over time
That's
with
right.
consistency, right?
Mhm,
And so EBB has invaluable like connections to community. Duke, UNC, other big institutions like that have access to funding,
mhm,
right? And so they have the literal powerhouses for identifying, competing, and and actually confirming or being able to get those big grants,
mhm,
huge, whether it's NIH, CDC, or wherever else. They have a machine to get through that process. But what they don't have are those connections to community. And I actually believe, as evident through EBB, that it's from the community where the optimal solutions are found.
mhm,
It's not within peer-reviewed articles,
mhm,
is not within NIH funded interventions where the real solutions are found. It's with the people who are directly experiencing the outcomes, the negative outcomes, because it's hard to really define how to address an issue when you have not actually experienced it.
Absolutely.
I
Absolutely.
feel
I
like there's
100% agree with you on that. I find that a lot of times, I think it was about a month or no, not a month. It was several months ago. I actually spoke. I was a keynote speaker for Chapel Hill's health equity research program, and that they were starting down here in Wilmington. And
mm,
one of the things that I spoke to them about was community and remembering the love of why you came into the work that you're doing. And while you're remembering the work that you're doing from a research base, remember that all that data are people. Those are real people that you have actually, someone has collected data on real individuals. So you want to treat it as such. Remember the compassion, remember the empathy. Do not speak accordingly in such a sanitized way when you're having these conversations. Because what
mhm,
happens is it brings a disconnect and you
mhm,
don't have a way of truly understanding. So, at every opportunity that you can, you need to go out into the community that you're doing research with and sit with them, not for any other reason to gather information, but just sit, walk through, go
yeah,
eat, go congregate with in that space and learn and observe for your betterment, not necessarily so you can take that on and say this is what I saw, but for your own enhancement, because that's going to improve how you do work and the lens that you look through. Community is the foundation of
mhm.
everything that we do. And and if you're only looking for it from a academic perspective, you're only as good as the last research that you've done.
Yeah, and what we've realized, I mean, well, what many people have already known is that research can be very exploitive, right?
Yeah, it
Um,
can. Mhm.
and the term that many folks are using right now is health equity tourism, where
Mm, yeah,
folks are just kind of jumping from one health inequity focus to another based on what's fundable, right?
hmm
It used to be what's popular, but with among researchers, what's fundable right now. And
hmm
the goal then is not to help communities, is to help oneself.
right.
Is more about individualism versus collectivism. And
hmm
collectivism is at the core of community work, and individualism is at the core of research in the traditional ways in which we do it.
Mm-hmm.
And so we cannot colonize research when we're talking about the difference between life and death for individuals, families,
Mm-hmm.
communities, groups. We can't just limit it to what's fundable. That is irresponsible and dangerous. And
Mm-hmm.
so we have to break away from that thought and also challenge it whenever we see it, which is why I always point to, hey, we need the voices of people with lived experience at the table. Hey, how are we working directly with community organizations? How are we not only just working with them, but also seeing their work as valuable enough to pay for?
Mm-hmm. Mm-hmm.
How
And then adding to that, and then giving them access to the information that we collected
right.
from them,
Ownership,
free,
right?
free, right? We're not charging
Democratization
them
of data,
to get that data back. Yeah,
right? Democratization of data, because that's also how that's research allyship, is when
right.
it's not just about what you own and you are kind of like lending it out, or, oh, we're going to partner for this short period of time for us to get what we need, but then we don't think about the implications for you once we are gone. It's about, we are invested in your sustainability. How
Mm-hmm.
can we support it? How can we ensure that the models that you have developed can now be strengthened, can be measured, and can be broadened if that is the goal, right? And
Mm-hmm.
so we like, that is what Joy is protecting EBB from, is that exploitation, that maternal health is a hot topic right now. There's a lot of funding for it right now. Hey, can we get some of the data that you collected from your families to apply for this grant? That's not how it's going to work over here, boo. You
Mm-hmm.
know, that we're not here to exploit anyone. We're here to save
Right.
lives. And so if your goal is not to save these folks' lives, then you can get on somewhere else and get your
Right.
data from somewhere else.
Mm-hmm.
But that is something that larger institutions, and I am a part of some of those institutions, I'm kind of on the fence, riding over here on one side and getting information and bringing it over here. And I'm like, hey, that's what they're looking for, but we don't say
Mm-hmm.
we got to do that. I'm trying to use my multiple positions for the benefit of my people, no matter
Yeah.
what.
To leverage it. Yeah. Yeah.
Yeah,
Mm-hmm.
yeah, but protecting our people, protecting our ideas, um, the ownership that we should have of those ideas are key
Yeah.
for community rooted organizations, or else, and we've seen it plenty of times, a community root organization will partner with a larger institution. That larger institution will take their ideas, their models, put their name on it, and then that community organization is gone.
Mm-hmm. Mm-hmm. Mm-hmm.
And
I,
that bigger organization goes with the funding for a period of time, and then once that funding runs dry, they're on to the next health equity issue.
Yeah, it is so, it's such a sad thing because we do see that quite frequently. When we talk about organizations that are community rooted, how can we do a better job of incorporating people with diversifying our workforce, our perinatal workforce, and making sure that we're inclusive of those with lived experiences in our workforce? Oftentimes, when we have this conversation about diversity, people are always thinking in terms of race, as far as diversity. But diversity is such um, a, a it is so big when we have the
It's very
conversation
big.
as far as diversity, because I think that sometimes some people don't realize that even within Black populations, we hear it and we say it all the time that Black people are not a monolith. I really believe that people don't understand that.
No.
That we are so far, we come from many different regions, many different socioeconomic backgrounds. There's so many different things. There may be some things that are common, like most of all us know about a candy lady within our community, right?
Right. Oh yeah.
But but at the same time, there are other experiences that you have that may be completely different. So
Right.
so understanding that, how can we do a better job at diversifying our perinatal workforces and ensuring that we have people who have lived experiences in those spaces?
So I think first we need, again, acknowledge who's at the table currently and how did they get at the table?
Mhm.
Where was it just assumed or given, that seat, or was it earned in some kind of way? Like, how do we determine who sets the menu? How do we determine who gets the seat? But in addition to that, we need to really do the work of removing the barriers to participation. So
Mhm.
some of those barriers includes something as simple as the timing of a meeting. Many people who are working, who have that lived experience, but are working, for instance, hourly jobs, do not have the ability, the capacity, or the desire to leave their job in the middle of the day to come to a meeting for 2 hours. That's just not gonna work for them. So we
Mhm.
need to utilize the resources that we have learned through COVID to make participation more accessible for everyone, whether it's using Zoom links, whether it's providing some kind of compensation for coming to meetings, whether it is offering childcare. All of those things can help with reducing the barriers to participation for individuals who have lived experience. Where meetings are being held,
Yeah.
it can't be where you have to pay for parking to get to a meeting that you are invited to. It shouldn't be the case.
Mhm.
Provide that good old little card that can give you some free parking, or better yet, reserve parking for that person. Hey, pay for an Uber, something that will allow for them to make, like, where it can be easily accessible, where they can get there with as little trouble as possible.
That's right.
Those are some of the ways individually that we can do that, but we also have to do the work of earning trust, being viewed as trustworthy, right? Trust is something that someone can have for you, but are you worthy of it is the question of trustworthiness, right?
Mhm.
Um, Explaining to individuals how you're going to use what they share in those spaces. Transparency is needed, right? If I'm doing a research study that I'm going to potentially use to apply for $1 million grant, tell me what is going to be the role of my data and how am I going to be compensated for helping you receive this $1 million grant, you know? Um, write individuals into your grants, whether that could be through consulting or it's something else. But the
That's a
issue
good
that
idea.
yeah, the issue that I'm seeing though with many grants, especially like NIH grants, is that it requires you to be identified through an institution, right? So you have to
Yes.
have a
A
principal
PI.
investigator or a co-principal investigator, or you're just identified as a community partner. There
Right.
needs to
Right.
be a clear position of a community advisor. Let's
Mhm.
change the language around it, because partner this is not necessarily a partnership all the time.
Right. Right.
But we can make it that way. Um,
Right.
if it's advising, change the terminology to express a understanding and a value of that personal experience, that lived experience. Those
Mhm.
are simple things that we can do. Um, we also
What
need,
about when it comes to something more upstream in terms
yeah,
of certifications? We also see here in North Carolina the stripping of many accreditations and licensing when it comes to midwifery. So, what about in spaces such as that?
we need we have to stop that. Like, that's another form of white supremacy, to say that you have to earn this type of certification in order to practice. When we have known for a very long time that's how licensure, even within social work, has worked. It was not to ensure that you have the most qualified staff members. It was more to exclude those who were working outside of the system in order to maintain control of who can practice. So if that's the goal of licensure, then that needs to be reevaluated and fixed. We need to make it where people have greater accessibility to those licensures or those certificates. So that includes reducing the cost or eliminating the cost for community members. There are possibilities for that. I've seen that happen where you have a certain amount of free signups that you can offer community members who you want to be a part of this work so that they can earn those certifications if necessary, if that's a part of the process, but then they don't have the barrier of having to pay for it too. Not requiring someone to have to go to 4 years of school in order to serve on an advisory board. So changing what kind of requirements are needed to be considered an advisor. It shouldn't be where you have to have a PhD in order to be an advisor. Having a PhD does not mean you know how to advise. Does
Right.
not know, does not conclude that you have the expertise needed for this particular advisory board.
Mhm.
However, lived experience, you can speak to that. That is something I wish there was a PhD in lived experience.
Bless their
Sometimes,
mind.
but really what it comes down to is not giving the PhD so much power. And this is coming from someone who has taken the time to earn a PhD. Sometimes we need to drop those titles. Drop
Yeah.
drop the letters behind the name in order for us to create an equitable field for very important conversations in order to come up with solutions. I've seen that happen in many spaces that I now have the ability to function in. Is we only going by first names here. We're dropping titles while we're in this room.
Mhm.
Something easy. That's something that can easily be done to really create an inviting space for community members or those with lived experience. It doesn't have to be a big deal, but I would say no matter what, you better back that ask up. That's what
Mhm.
I say. You better back that ask up. So if you're asking community members or those with lived experience to offer uh some insights or to share their experiences, which in itself can be very traumatic,
Mhm.
you need to provide them with resources in order to do it.
Mhm.
And you need to show that you value what they're sharing, not just that you want to use it, but
Mhm.
that it is meaningful work. You don't ask a CEO to come anywhere for free.
That's
So why
right.
would you ask a community member to come anywhere for free?
I love that. That is exactly right. We need to make sure that we're giving value to them, um, and giving value to their time that they have
Right,
taken out their day,
right,
to come and be with us and share their life with us. I always like to say, people go where they're welcome, but they stay where they're valued. You know, and so when I welcome you, I might roll out the red carpet for you. I might show you that, oh, I got snacks and checks and I didn't order from the best restaurant where you can have some food and everything like that. But after I have welcomed you, what have I done to help you see that I truly value you and the
exactly,
information that you're sharing with me, and making sure that you are a part and transparency and everything that I'm doing along the way. But now that I have your information, I'm no longer going to share information about the next steps and where we're going and what things are doing, and no longer giving you updates. We have to
right.
make sure that we let people feel valued, when we are working with them. With your knowledge, about the lead doula program, and your understanding of doulas, how effective do you think reproducing programs such as the lead doula program would be in other areas of, not only North Carolina but just in general as far as nationwide?
I think programs like the Lead Doula program are excellent in terms of having a focus on Black individuals becoming trained and prepared to support their communities.
Mhm.
I'm always going to be a proponent of that, in which you're almost formalizing what already is being done. You're
Mhm.
providing, the training and education needed to kind of be able to navigate these very complicated systems.
Mhm.
And I also acknowledge that, sometimes, unfortunately, those programs, because of where they're housed, can be another way of excluding communities,
Yeah, yeah.
because there are, certain guidelines and
Mhm.
practices that you have to follow once you are now a part of this larger institution.
That's
So
right.
what I would love to see is programs like Lead Doula, but based in a community. Like, I would love, instead of it being based, for instance, on UNC's campus, I would love to see it based in the heart of Durham.
Yeah.
So,
Yeah.
I would love to see it where community members can literally walk in at any point in time without having to figure out how to park, where to park, where can I park where I'm not going to get towed, how can I get into this building that's very huge, where do I even find the room? All of these things. It would be so beautiful to see something like that right right out my window, you know?
And also to add to what you're saying, as much as I can sing the praises of lead, some of the barriers or challenges along with that is the fact that it's only designated for those who go to UNC. So if you're a lead, if you would like to participate within the lead program, you cannot be seen at Duke or at Wake, or at any of the surrounding hospitals, which can pose a challenge because if I stay in Clayton,
Right,
which is the surrounding city, right, or Fuquay, or Durham, and if I go into labor, it's going to take me forever to get all the way out to Chapel Hill in order for me to deliver my child.
right,
Whereas if you are my doula and you're a part of LEAD, you can say, meet me at the closest
yeah,
hospital, and I will
right,
be integrated and welcome into that particular medical center. And so the benefits of the LEAD program, as to the point that you're making, it's wonderful for the community and it's wonderful for those that have accessibility to utilizing UNC Chapel Hill Medical Center, getting there, being a part of the system, and being in that space. But if you're not in that space, then and in addition to, they're welcomed at UNC Medical Center. So I want to make that point. They are definitely integrated within their
right,
medical center. The challenge is that oftentimes we find that doulas are not welcome into the medical center system. And
right,
so because they're not welcome into the medical center system, then that means that they are dismissed. And that is a barrier that I find with programs such as LEAD, because they're only isolated to one particular hospital.
right, exactly, and as someone who went to UNC for all my degrees, UNC is not the easiest place to navigate.
Listen, I know. Come on, Tar Heel.
It
From
is
one
it is
Tar
not
Heel
the
to another.
it is not the easiest place to navigate, and
Yes.
that could be intimidating on its own to have to come to this big campus to receive this. I'm talking about even just receiving the training, not even the benefit of
Absolutely.
even the services, just the training itself.
Hmm.
And so, I just and I also always become concerned about how what changes are being made once a program is under this larger institution, because there's going to it would be naive to think that a program can stay the same
Hmm.
whether it's under this bigger institution that is under another bigger institution that isn't under another bigger institution. It's impossible for them to remain community focused. It just because the measures of success are different at each level.
Yeah.
And
Yeah.
so I would love to see one that stayed where the ownership was of the community, not under this
Hmm.
larger umbrella in which people become further and further away from the actual goal and mission of the program.
Hmm.
Their
Yeah.
goals are totally different, more, economically driven, and, that leads to the same results sometimes down the road.
What better, and you're actually already speaking to that, and which is making things a lot more community rooted, when we're talking about community, when we're talking about organizations or programs such as LEAD. What other strategies would you recommend, to help keep things a lot more community focused, when we are trying to implement programs, around like doulas, midwifery, perinatal support, even nurse practitioners in two spaces? How do we really design in a way that, in terms of design thinking, and modeling, to make sure that they have its roots within community, but at the same time meeting those metrics of those larger systems? What are some ways that you think that we can get around that?
Um, Honestly, we don't have to get around it because there are community-based organizations in community rooted organizations that are doing very similar work, but just aren't getting the funding or the shine of, you know, like programs like Lead Doula are. Like I think about Aya,
Okay.
Birth Center, Birth and Community Wellness,
Mm-hmm.
where literally Tina is working on creating a community-based midwifery center, like birthing center based in the community. But she is constantly fighting for funding. Same thing with Mame, where they are training doulas. Same kind of models, training doulas, but who gets the funding? It's hard to compete with UNC because you fall under the umbrella when you are a community organization that's independent, right? And
It
so
is.
I really would love for us to change the funding streams.
Okay.
I want to see funding directly given to community rooted organizations. I don't want it to be where the money is lent out for you to do this one specific thing that we need you to do, and then you report to us what you did, and then we go on about our business. I want it to be where community rooted organizations are invested in, that their sustainability is the goal of the grant, not just, you know, getting data to go on and hopefully, you know, write an article that may one day contribute to some kind of interventions. I don't want papers to be the goal of anything related to maternal health. I want it to be the wellness, the well-being
Right.
of mothers or birthing people and infants. Community rooted organizations understand that because the people who do and lead those programs are not driven by money, clearly. But we need those who are driven by money to actually put the money where the work is being done.
So let's talk about that. Let's talk about how I know in New York State, not too long ago, maybe it was last year, they closed another birthing center. Um, and it appears that across the nation that there are more and more birthing centers that are closing. What do you think are some of the ways that we can have those conversations with those who have grown to have deaf ears and not understanding the importance of having spaces independent of a hospital, a birthing center? Is completely different. How it's set up, how it moves, all of the parts of a birthing center. It is a medical system, but it's focused on the actual care of the mother. So how do we get people to have more a understanding and move towards putting policy in place and hearing that so we can have less birthing centers closed and we can have more birthing centers be open because it's not just the fact that they're closing, they're also putting in a lot of red tape to prevent them from opening.
Or prevent them from being paid, right?
That part.
So it's, oh goodness. It for me, in my opinion, it all starts with changing the priorities, right?
Okay.
Currently, our health system, and it's very clear in the US, our health system is economically driven.
Yes.
We have payer system that really determines what kind of regulations we're going to have in terms of what kind of health care we should receive. They determine the quality of care that we receive. It all depends on what is going to be paid,
Right.
right? And so in order for us to prevent more birthing centers from closing and to support the ability of more to open, we have to divest from that view that health is wealth.
Mhm.
We cannot continue to sign up for that way of thinking or subscribe to that way of thinking, because then it's always going to be those with more money are viewed as being the better experts in health.
Right. Right.
While those who are here in the community and doing the work despite the financial burden that comes along with running a center with very little money,
Hmm.
like literally, I The only motivation that organizations like MAME and Aya and EBB have are people. That is their clear motivation. I cannot say the same thing for Duke and UNC because they don't have that connection to the people. But they have the resources to support those organizations.
Mhm. Mhm.
But do they? Not in the way that they need to. Not in the way that they need to. So
Right.
it it honestly takes us changing how we do healthcare, how we invest in it. How do we see it as a right versus something that you earn through your economic or through your job? Like
Mhm.
even the practice of getting healthcare through your job contributes to that economic focus of
It
health.
does. Mhm. Mhm.
And so we this is going to the point of needing a universal healthcare system,
Mhm.
right? Where everyone has access to the same care, therefore everyone is demanding better care. It's not where someone is saying, "Oh, well, I have this private health insurance and I get this kind of care, which is amazing for me," while someone who has Medicaid is getting this kind of care and is like, "Well, I wish I can get that kind of private health care, but this is what I can pay for," right? We need it to be where it's equitable.
Mhm.
Everyone has access to the same health care. When we have all the same access to the same health care, that means we are all demanding it to get better. We
Mhm.
like if a CEO, again, a CEO and someone who does work with a cash register are
Mhm.
all receiving the same care. That CEO is going to use their voice to ask for help, and then the services should improve for everybody. That's why we focus on Black women in
Mhm.
terms of the maternal health care crisis, because it is a crisis that affects everyone. When
Mhm.
I quote how many maternal deaths we are experiencing in the United States and being the only high-income industrialized country to experience a rise in maternal deaths over the last few years, that's for all women.
Mhm.
That's for white women, that's for Black women, that's for Latino women, that's for everybody. Asian women, it's for everybody that we have these poor outcomes. And so when we're able to focus on those who are experiencing it the most, the most harmful effects of this current system, then everybody benefits.
That's right.
And so that is what equity is. When we tackle the needs of those with the most needs, then
Mhm.
those with least needs are also having their needs met too.
Yeah. Yeah.
That's what's going to be required in order for us to support the sustainability of birthing centers. We have to show that we value it beyond the economic pull of
Yeah.
our healthcare system as it currently exists.
And what do you think about institutions, academic institutions, doing a better job of lobbying our policymakers to help them? Since a lot, oftentimes, our academic institutions are that midstream that's in between. They usually are the ones who receive the funding, who then distribute the funding, right? And if they could do a better job of lobbying our policymakers and letting them know the importance of said issues, Black maternal health, birthing centers, things of this nature that we know that are extremely important for our community, and lobbying our insurance companies, to pay. Because oftentimes, if you choose to go to a birthing center, it would not be paid. You would have to pay
Right.
that out of pocket versus you going to a medical center. Well, they will pay for you to go to the medical center. They'll pay for you to go to the urgent care before they pay for you to go to the birthing center.
Right. Which
It
why?
just don't make sense,
Why?
right?
Yeah, we tend to be more reactionary than preventative, but yeah, I mean, yeah, the payer systems need to be brought to the table and say, "Hey, we can't do this anymore." But it all comes down to identifying where with all these strings being pulled and all these decisions being made that negatively impact Black birthing people,
Mhm.
who is going to step up to be the solution,
Mm.
right? Those with the most power have to step up and they have to do things differently. I have met with CEOs of some of the biggest healthcare systems in our country. I've met with the CEOs of, organizations that determine what kind of healthcare research we do, how do we measure and improve the quality of healthcare that is provided throughout the United States. I've met with those, or I've talked with payer systems such as Medicaid
Mhm.
and Medicare, and how they inform regulation around maternal health. So I tell them each and every time we need everybody to be a part of the solution, or else we're going to continue to have the same problem over and over again. And it's not until someone within your family is affected directly that you begin to care. We can't wait. Like we should not wait for that. It should not be where we are reacting to a tragic event in order for us to do something positive. So, like, I it's kinda it's I took that deep breath just thinking about last week in the election and thinking about how do we hold people accountable. Voting was one way that we hold people accountable, but I also think becoming politically involved and really using your civic duty and reviewing what's happening in terms of policies and writing your representatives about policies that you want them to vote for or vote against. All of those things are things that we can do as an individual, but we really need to put the pressure on those with power to really move it forward.
Yeah. Yeah. This has been such an enriching conversation, and I always love talking with you. You and I could talk forever.
Oh yeah.
Um, and I'm so glad to call you girlfriend. I would like to. What are your final notes? What do you want to leave with our interview?
I want to leave with a call to action for all of us because we are all born.
Mhm.
Um, Therefore, we all have a stake in this issue. Um, I want us to do better for our future generations. I think about my daughter and I think about what rights she's going to have in terms of her reproductive health compared to me, compared to my mom. Um, we should be moving forward, not backward. We should be achieving better results, not worse. And I think in order for us to really make change, we have to see this as a public health issue worthy of fighting against, um, and worthy of our efforts, worthy of um, our investment in time and energy and money. We need to see this as a life or death situation because sometimes we don't do anything until we are pushed to the very edge of and we have to make a decision. I don't want to be pushed to the edge anymore.
Yeah.
I want future generations of birthing people to go in with confidence, knowing that they're going to receive the best care that is possible despite their economic situations, despite the color of their skin, despite what accent they may have, despite whether they have a birthing plan or not, whether they are married or not. I want people to come in with some sense of peace when giving
Mm.
birth. I want peace for folks giving
Yeah.
birth. I think it says a lot when we are bringing children into this world through trauma.
Yeah.
And I feel like we are gonna be seeing the consequences of that for a very long time. We need to do things differently. If we want
Yeah.
a better society, we have to support births in a better way.
Yeah, we do. We do. I want to give you a virtual hug. Thank you. Thank you. Thank you. Oh my God, I got to come to Durham so we can go to dinner.
Yes,
Like,
please.
just oh my gosh, you're just amazing.
Aw.
I want to support you. Just let you know, as I said, I'm here for you. From one eagle to another, from one ram to another. And thank you for all the work that you're doing. I see you, my sister. I do. I see you. I see the work that you're
I
doing.
see you too.
And oh, thank you. And we in this fight together, girl.
Yes,
So
we are. I'm gonna
I
continue fighting. I know you are.
Yeah. So yeah. So because when you get tired, I got your other arm and you got mine. So we right
Yeah.
there
And
together.
we might have to sit down for a minute, but we're gonna get back up.
Yeah, that part. That's for real. So I hope you have a great remainder of your day.
You
Thank you so much for
too.
giving me so much of your valuable time. And I will submit this information. Once the video comes all together, I send that over to you so you can take
Okay.
a look. And yeah, I will see you in the funny papers.
All right. All right. Take care, Vaughn. It was so nice
Okay.
seeing you. All right.
Yes, talk to you soon. Bye, honey.
Bye.